When you tell me you're going live, then I will.
Yeah,
Can I
okay.
start?
It's live. Yeah. Start the
Good evening. On behalf of Hyderabad Management Association, I welcome you to a very relevant and important topic, impact and challenges of Omicron. It is my pleasure to invite our MC members, past presidents, our speaker for today, Dr. Sethu Babu, and our moderator for the session, Mr. Suresh Pachatil. I also welcome our convener, Rajendra Krishna Prasad Peddi, our secretary, Dr. Ravi Kumar Jain, our vice president, Mr. Ramchandra Vyasabattu, our editor. I know he's wearing a lot of caps. This is Shankara Venkata Krishna Prasad, and our advisor Devendra Reddy, our another MC member, a very old one, HMA member, I can say, life member, Vijay Vedantam. And today we had a very good MDP program. Dr. Renuka Sagar was the convener for that. And with this, I request our president to take this forward, Ms. Kavita Rajesh.
Thank you, Geeta. Thank you. And a very good evening to one and all. So, Dr. Garu, Sethu Garu, thank you for accepting this, and Suresh Garu for moderating this session. We can see it will be a vibrant session with both of you getting involved. And today we are talking about COVID. And if you see, the cases are increasing 10 lakhs per day, but the figures are not told. And still people, as we are talking about new normal, I'm not sure when the normal would be there, but still people are with skeptic minds whether to meet or not to meet. And it's a very pertinent topic of the day, because industry has to move forward, people have to meet each other, and nothing is standstill. Coming to Hyderabad Management Association, it is a premier association of management professionals in the state of Andhra Pradesh and Telangana since 1964. It has strived relentlessly to project contemporary management practices leading to good governance in the industry, education, and businesses. It is a unique platform for practicing managers, entrepreneurs, academicians, and students to stay abreast of contemporary management practices, even shaping the young professionals with emerging challenges and meeting their objectives. Hyderabad Management Association conducts various activities like student development programs, faculty development programs, and management development programs. We had one today. It was very interesting to talk about. Today's topic was, I'm sorry.
Emotional intelligence.
Yeah, emotional intelligence. And that was well articulated by the Cognizant Ed. And we do such events, and even today we are talking about, and because we want to orient people with all walks of the lives with what is happening in today's, the objective of the management principles, we want to get it across to people. And we also have started various initiations at Hyderabad Management Association, like MSME Desk, where we are connecting with MSME and institutions and bankers and all to do, and getting associated and bridging the link gaps in between. And also we have started a social impact desk addressing the problems across in the society. And we are doing a water harvesting at the government schools, so addressing and teaching the future tomorrow of conserving water at the school level and teaching them the best management practices. And apart from that, we have started an international desk where it is being convened by a convener, Krishna Prasad Garu, and he is trying to do his best. And we are connecting with all the consulates across to reach the global levels with the management practices, and also to exchange their thoughts from the other countries, and also educational aspect of it also we are trying to do. And we are also coming with the third batch of IRP industry readiness program to bridge the gap between the campus to corporates. So this is in a nutshell about Hyderabad Management Association, and our theme for 21-22 is management resilience, impact, innovate, and globalization. So the Hyderabad Management Association has come up with a flagship program, the awards which are most looked forward in the industry as such. Recognize the excellence in managerial, entrepreneur, academician, and CSR Women Award, college student chapters as much they are awaited. And I would request all the participants to please promote this in the network. And 31st is the deadline for the nominations. I would also request Dr. Garu also, because you are doing the best things as a gastroenterologist. Also, we request people like you also to please participate in our awards. Thank you, sir. I would request Rajendra Krishna Prasad Garu to introduce the moderator and the speaker. Thank you.
Yeah, thank you, ma'am. It's welcome to all, one and all, for this today's evening session. And it's my privilege and honor as a convener of HMA Young Leaders Committee convener. Today, I'm only introducing, giving the title about the topic that's emerging trends and the challenge, impact and challenges in Omricon, the third wave of COVID-19. And this particular topic is going to be presented by Dr. Sethu Babu, gastroenterologist from KIMS. And I'll be introducing about our moderator, Suresh Kochari, who is going to take this whole proceedings. And he will be introducing the doctor topic and we'll proceeding along with the chat. Okay. Yeah, that's Suresh Kochari is a graduate of Osmania University and did his hotel management course from Institute of Hotel Management, Chennai. He started his career at ITC Welcome Group, Banjara in Hyderabad, 1986, and then worked later with Taj Group of Hotels in Bangalore. In 1999, he moved to the Times of India Group in Bangalore. Later, he relocated to Hyderabad. In 2007, he quit after 17 years of long service with Times of India and moved to Apollo Hospital. In 2017, after a 10-year stint, Suresh Garu relocated to Livua Hotels, Ab Towers in Bangkok for about 1 year stint. Suresh Garu is very active on social media and with a dedicated following, he is considered an influencer. And he is also one of our senior member and advisor of our HMA. Suresh Garu, it's your time to take the floor and introduce the speaker and as well as topic, a brief about the topic and go for the proceedings, sir. Thank you. You're welcome, sir.
Thank you, sir.
Thank you. Yeah.
Thank you. In fact, as Kavita ji spoke, and I just wanted to make it different. We had guidance yesterday, we had a guidance today. And what we thought was usually when we get into webinars, people say, oh no, God, another webinar. You know, we have this kind of stuff. So my main take on this is let us give it a freewheeling discussion. We told Dr. Sethu Babu also that we will keep it very free. Button whenever you want, ask a question. You don't need to wait till the last. If you have a doubt, let us keep it freewheeling. Otherwise, what happens? People don't have the patience to wait till the end. And sometimes they may quit halfway through and not able to ask the question which they want to ask. Before I introduce the speaker, in fact, today I had gone out with my wife to do a couple of things outside since today was a holiday in the office. So I found, the first place where we went was in Lal Bahadur Stadium, a small shop, but there was nothing much there. But later on, we went to the Metro Shoes and Habits, and the place was packed. Packed is not the word. I asked myself, are we seeing it or are we seeing something else? That is what was most surprising thing. And after that, we went for lunch in Kamath Hotel in, next to the RBI. And there again, we had to wait for a place to sit. It was packed to capacity. I'm not exaggerating. There was not a chair to be had. So when we're looking at this kind of situation and with a speaker like Dr. Sethu Babu today, I'm honored to introduce him to our esteemed audience for this webinar. And Dr. Sethu Babu is a senior gastroenterologist and in hepatology from the Krishna Institute of Medical Sciences, or popularly known as KIMS in Secunderabad. He did his MBBS from Andhra University and did his MD in interventional medicine from the Osmania Medical College. He did his Doctor of Medicine in gastroenterology. As you know, after you do your post-graduation, the doctors specialize in something beyond their MD stuff, and that is what they did. He did. With a fellowship in hepatology from King's Hospital, London, Dr. Babu has been awarded the FCGP by the College of General Practitioners. In fact, he has a vast experience in starting out as an assistant professor of gastroenterology at Osmania Medical College in Hyderabad, professor of gastroenterology at the Andhra Medical College in Visakhapatnam. And Dr. Sethu Babu has been associated with the DNB training program since 2003, as you know, where students are also trained. And today, in fact, as we speak, he is also parallelly conducting a training session of other for the students from different medical colleges, and as we speak. So he's switching on between two laptops, and that's what he told us yesterday. Another personal thing that I have with Dr. Sethu Babu is that he hails from a neighborhood in Kerala, Palakkad. Not many people know that. And in fact, Dr. Sethu Babu's wife, in fact, she hails from my hometown, Thrissur in Kerala. So that is another very unique thing with him. And I mean, there are a lot of things I can go on and on about him, about his research in clinical trials, his publication, the papers he presented. But I don't want to take away his time because he has a what we call an excellent presentation with him. And before he starts, of course, I would set the ground rules. I would ask all of you to please mute your phones so that we don't have a echo and other issues that are there. And whenever you want to ask a question, just either you can raise a hand. Mr. Rajendra is tracking the chats, and we can get in the questions whenever you want to have it from Dr. Sethu Babu. Sir, Doctor, I leave the floor open to you to start the session. I'm sure we will have a very, very interesting conversation on Omicron and other variations of the COVID that we are seeing today. Thank you.
So let me thank every one of you. Wonderful. My sincere thanks to Shankara Venkata Krishna Prasad. I think he has got so many things. And for making me a member. So it's actually an honor to be a member of such an elite organization. And the simplest thing is you come to know more and wonderful people. And the moment I joined, they said, you talk. I took a personal interest in COVID ever since I saw the first case. And we were excited because I did work with Shanta Biotech, and you would be surprised if I'm not doing self, is I toured 22 countries to promote the Shanta Biotech Shanvac. I was very close to Sri Varaprasad Reddy. We together did a wonderful job. So taking the clue, let me start my presentation. And you are able to see my slides,
Yes, sir.
So
Yes, sir.
I have to, I think I can go ahead now. And what I need to do is I had to make it
Full screen, sir.
full screen.
Slide.
That comes with my laptop doesn't show full screen. So what do I do is mute, stop video security participants more.
Karthik, can you help, Doctor, please?
Can you make it to full screen, Karthik? As I already sent the slides to you, because so that I can change it easily. Because I'm
Karthik,
not-
Sir, can you, as explained, can you make it picture?
Yes, Doctor, you can continue, Doctor.
I think I can continue. I think the word pandemic is suddenly known to everybody, and pandemic is actually not new. We have seen so many pandemics happening, including yellow fever and all. And I myself associated with a very big so-called, if not endemic, it's a pandemic. If not a pandemic, it was an endemic in dengue fever. And we had in Usmania Hospital almost 110 patients in the ward. So there's nothing new. So taking the forward, the disclaimer is sharing acute wisdom is like, spreading COVID. I think every one of us really are powerful. Initially, when I was a student, they said, if you know syphilis, you know the entire medicine. Halfway, somebody said, if you know HIV, the retroviral infection, there's no, you know, entire science, because that's a manifestation. Now, today, if you know COVID, you know everything. I think that is where we moved on. One of the most horrible feature of the pandemic is that all the propaganda and all the screaming and lies and hatred comes invariably from people who are not actually inside the pandemic. And those people who are in pandemic became suddenly humble, and very few people, unconnected. You can see all the TV shows. ND 24/7, for example, spoke so much about it. And you don't have to, you read Hindu paper and follow ND 24/7. You don't require any textbook to read. I was very happy with gentlemen who said, don't worry, be happy. And these people say, what can we do? It is all happening. That's all right. And this was the first paper that was published actually, in the Indian Journal of Medical Research, one of the very good journals. And that was the first patient in Thrissur. And this girl came from Wuhan. She was a medical student in Wuhan, and she brought the one. From there onwards, we really do not know how it has spread so fast. the reasons unknown, it has spread very fast. And then the first publication came in February 2020, as if it's a novel coronavirus, which and from a China. And there onwards, there was a lot of debates. Is it a Chinese or is it a laboratory made? We will not go into all those controversies. It's a big story.
Excuse me, doctor. Doctor.
Yes.
Yeah. So your face image is just a little up, doctor. Yeah. Yeah. Now it's.
I think you'll be interested in slides and not the face. Okay.
No.
That's a small punch. Okay. So what is the exciting revolutions in the evolution of COVID infection is something surprise happened. We came to know everything about this. When I worked with hepatitis B, it took 15 years for me to understand from zero. But it took exactly a few months to understand the entire virus. And when I saw what I downloaded I purchased a laptop for this, and it was full, 900 articles, which were actually relevant to the treatment and diagnosis and all. I'll just quickly go through. The life cycle of the virus is completely defined. We know everything, its amino acids, its genetics, everything is known. We also made very fast early diagnosis with very sensitive tests. We call the rat test, PCR test. You can do the salivary test. You can do urine test. You can do fecal matter test. Everything you can test it today very easily. And surprisingly, it is available in very small labs. The pharma industry and the lab industry moved such a fastness that the 22 test kits are available commercially, and they can detect as early as 30 minutes. The rat test called the rapid antigen test, and a PCR which comes in about 4 hours, and everything is super fast. And the fastest viral preventive vaccine, which never happened. No vaccine ever developed in few months. Unbelievable. And the credit goes to Indian success. Maybe I should say Hyderabad is the most successful. I had a detailed discussion, and I must admire or appreciate Professor Yella Krishna, who suddenly became the giant in vaccinology. Earlier, I had a very interesting interaction with Varaprasad Reddy when we worked with Shanta Biotech for about Shanvac B. And more specific drugs. We started with hydrochloroquine, which is a landmark paper published in NEJM early 2020. Today, we are talking entirely an exciting drug. I'll just make a little mention about it. And we are now looking at it. How do we prevent this approach as the virus weakens? There is something called passage of any infection over a period when it passes through multiple passages with different individuals. It changes. This is what we call mutation. And most of the mutations, let me tell you today with emphatics, will be benign and do not cause problems. And that's what exactly happened in Omicron. I'm not surprised with it. So we now looked at, we changed the Delta, which was the known. In fact, we have Alpha, Beta, Mu. So many names were given. And different countries have, Japanese have called it different. Chinese have called, they don't want to tell the names to us even. Because Chinese, when they publish, they don't publish in English literature. Japanese do not publish in English literature. So we do not know some of the local names which they gave. There is, somebody said there is something called Demicron, which, and then somebody called it Fulcron, and so many other things are, and many more will come. Don't get worried. All are same actually. The virus is same. All these things are very well known that there are certain set symptoms and set pattern. But what is happening is there is a change in the clinical spectrum of the entire disease. Many of them do not have symptoms. Many of them have mild symptoms. Many of them have moderate symptoms, and few have severe symptoms. Earlier, you look at the waves, the so-called the first wave, second wave, which took it to peak. Third wave, I prefer to call it as clusters because it may not take the wave form. I'll show you that to you. So we know different one and the presentations are different. But remember, anybody who comes with fever, cough, or cold-like may not be everything like, COVID. Don't have to fear. And this was the one which I first put it in my colony. Do not worry, you are safe. Take self-care. Keep hands clean. Keep a distance. Keep mask always. So very interestingly, one wife and husband came to me, sir, should we also keep distance? I don't have an answer for that, but it's okay. Now,
Doctor, may I interrupt you there because I think we're getting into an interesting discussion.
Yes.
That is why not the presentation to run all along and then finally have the question.
No, I'm
One
ready.
question that has question to come to me already is about the use of mask. But there's now a confusion as to what kind of mask works for Omicron, because there is a talk that N95 works best. There is a talk that cotton masks are no longer reliable. What is your take on this, sir?
I'll tell you, any mask will work. But what happened is they are using the same mask. These masks are kept in the pockets. These masks are kept in the boxes and all. So the only thing is any mask will work. N95 by means of the nanopores, it is supposed to be more preventable. The conventional mask, which is available for 3 rupees also shows. But more than that, it is not the mask. Do you have your opposite person have an infection, or is he coughing in front of you is much more important than the mask. Israel is the first country where they said no more masks. This is the first country which broke, and they said they have given 4 vaccines to every one of their population as a government policy. So I will tell you the predictability is that by end of March, all of us will become very loose with mask, and we may actually remove the mask by the end of March, and there will not be any rule. There was some period where they said if you don't wear mask, you will have 1,000 rupees. Answering to you, fine. Answering to your question, any mask will help, provided your opposite person is not infected.
Continue, doctor, continue.
So there was a huge thing with this is the oxygen. You know that it is pathetic to know that some patients really died because of lack of oxygen. But let me tell what actually decides the outcome is not hospitalization. It is the age of the patient, elderly, diabetic, poor nutrition and pregnancy, and their late presentation to the hospital. At one time, we saw 40 people on ventilator. Only 1 or 2 anesthetists take care, and there was almost 90% mortality, those people who go on to ventilator. But if the patient can have oxygen as a support and have some breathing exercise, most of them have recovered. And as I said, as the virus passes down, it loses its potency, and that's what happened with Omicron. So the more COVID tests are now made available, more cases are getting reported, but still the mortality tends to be very low. And as somebody said, this is what Professor Suresh just said, and this is what happened in all the markets that is happening. Now, why if the virus will not spread? And this is what happened a few days back in the Jataras, and then everything happens like this. And I'll tell you the best joke. This is what happens air travel. And you think it's safe now? I think it's so, and somebody will cough, somebody will sneeze. And in fact, patients have come to the hospitals, and some of them are actually patients. So I think this is the best thing that happened. Now, I think this is my very interesting slide. If you compare 3 important countries, we always want to compare and US, and look at what happened is that the United States got pegged up around here and trying to come down significantly. It is because of the intense vaccination. They're very, very serious about vaccination. We are having a fear as if this is today's data. Are we going towards the so-called peak here? But I assure you, we won't. We behave like this now. You can see our behavior will change. It won't go to the peak. But look at what happened in UK. It went very steep and trying to come down very fast because they kept rules very rigid. So the community spread is very fast thanks to the festivals. And government says, do not fear, which adds WHO has no guidelines. They all make their temporary guidelines and they're very weak. It has proven that they're very weak. I'll come to another controversy between ICMR and DCGI. People wants to behave normal. There is overconfidence about the vaccine. Drug therapy is fast evolving and mortality is very low and acceptable to us. I'll just give you that particular figure. So there is a robustness of specific memory T cell, which is very important. The body is able to recognize, and Omicron wave may cut future severity of the pandemic. This is what is the best hope we have. So we actually have to welcome the Omicron with, due respect. Now, those who previously caught the Delta variant could actually contract Omicron. That is why you say, I have suffered, but I'm getting it again because that's a mutational variation, which again causes infection. But if you have had Delta, your Omicron would be very, very weak. Those who get Omicron strain could not be infected with Delta. That's something which is very interesting. So if you have primary Omicron, you may not get Delta because the antibodies produced by Omicron does help you prevent Delta. So again, once again, I say have Omicron rather than Delta. Omicron can displace Delta, or they can have a dual infection. There were a few case reports where they had both the infection.
Doctor, just interrupting you there, one question that has come in is regarding the antibodies. Now that you were on that flight, so I brought in that question now because that question had come to me earlier. Is about how do we check the antibodies? Because in India, the checking of antibodies really doesn't happen with people who either got a vaccine or got this infection. What is your reasoning on that?
Yeah, let me tell you my experience. I am asked to take third dose as a protocol. Then I said, no, I will use my own science. So I went and checked my antibodies. It is 1540. That is because I had 2 vaccines and then I had a COVID infection, which is very mild, and I recovered very fast. And I took the first clinical trial medicine, which I like just tell you very quickly. So I am one very example standing in front of you where I have large antibodies. Okay, there is something called minimum.
What is the cutoff? Yeah. What is the minimum?
Yeah, that's what I'm coming. I'm coming. I think more than journalist, you are becoming judge. Okay, wonderful. Nice. No. I welcome the question. So the minimum cutoff is 106 was taken as laboratory cutoff. 100 is the cutoff. If somebody has got more than 100, their chances of getting prevented by the infection or the infection getting a blunted response is very high. So I would always pray that. Then what happens is there is a small scientific misunderstanding. I have a conviction that those who become antibody positive, the next infection will act as a vaccine. So I'm actually waiting for Omicron. If it has to come, let it come. That will act like a vaccine. So I don't have to fear. Don't fear first. Please, for heaven's sake, don't fear first. If it comes, it comes. But you don't go and then touch somebody and say, come on, Omicron, come to me. No, that's not the way we do it. If it has, it will come. It will come very fast because it has got one basic character, super fast spreading, because we call viral load. A small viral load is enough to infect a human being, unlike Delta, which requires large viral load to infect. So let me move quickly forward. I think I'll make few quick statements. This is a clumsy slide. Coronavirus Omicron India, Delhi and Mumbai see a dip in COVID cases. I think that's very interesting, which I was showing. Active COVID-19 cases decline in West Bengal. These were the states which have shown a very high number. Look at what happened in Tamil Nadu. It is also showing. And I just want to attract here, see, even the death rate is very low. And this is what I'm worried. If I get COVID, will I die? No, the chances of you are independent, or the statistics is less than 1%. Look at Kerala. And look at the number of deaths and the number of infection. Very, very interesting. Gujarat has received almost 90,000 claims for COVID death compensation. But at that time, the reporting is only 10,000. Here we need to interpret this in our own way, that the reporting is 10 times less than what is actually happening in community. People do not report to either hospital or a healthcare system. They might go to their family doctor or somebody, their assistance and take some medication. That shows, even though the number of cases are very high, I underline the mortality is very small, and mortality is associated with pre-existing comorbid conditions. So this is the patient attending the hospital. There is a very interesting, actually, this is a British study, which I corroborate with our own presentations also. Right now, I have 11 patients in the hospital, and they're all admitted in the hospital. None of them are COVID, and 9 are COVID antibody positive from their pre-vaccination. So look at what happens. They're actually admitted for something else, and the COVID admissions are very high in the European hospital, but this is not the scenario in our hospital. We have very small admissions. During the peak, we had around 500 admissions. During the third wave currently, which is in its mid peak or whatever it is, we have only 50 admissions. So I think there's a very interesting thing that the severity of the disease is much less. I won't go into the testing because it's a very simple one-time testing. And is every person who has got flu or cold-like illness, COVID, we test the PCR positivity, and if it is negative, we actually close the file and say, don't worry, just go back to your cold treatment. So we did learn some lessons from COVID-19 infection, self-limiting acute viral infection, very low case fatality rate. Looking for new treatment options and antivirals, I'll quickly go through a couple of my slides. Vaccines have reduced the new infection to a great extent. The new infections are often asymptomatic and less severe thanks to Omicron, and the post-vaccinal issues are not addressed completely because there were some publications where people who received the vaccine had some other problems. We have to raise that in a separate platform, but that is not a subject, because if you look at the large number of vaccinees and the side effects, it becomes insignificant. So the risk benefit of vaccine overrides all the data. Do you need a third dose or more boosters? This is something which we have to independently address. Maybe I'll take it up when you ask me. Which medicine works better?
Doctor, 1 minute. I'm just interrupting you there. Question from Mr. Ramchandra, since you are on that specific slide about this vaccination part of it. Is cocktail kind of medicine that are being used to do the treatment?
I'm coming to that. That will come to me next. I'm coming. Right
Sure.
now, I spoke to the introduction and about the disease and all. I'm coming to the treatment which is available very quickly from general perspective. So which medicine works best for COVID? At one time, in the early of 2020, when this was announced, the entire medical shops sold all vitamins and everything, zero. Zincovit, most popular, sold in tons. I'll tell you the Dolo 650, the company, which is a microlab company, sold 800 crores. Some simple paracetamol, which otherwise has a threshold of only 100 crores, has sold it. We don't know about crocin and other paracetamols and conventional paracetamols done by the second level pharma industry. But Dolo 650, which is, every doctor answers, why don't you take a Dolo 650? And it is 800 crores. You can see the market strength. Vitamins, zinc, they were all sold like anything. Every prescription has all these things. Today, we realized nothing is really required. Coming to your question, we have some wonderful drugs. This is the one probably I'll talk about it. When I was waiting for this particular drug, interestingly, stop me if I am exceeding my time. Molnupiravir was the drug. I had a lot of things. We did a clinical trial for Natco Pharma, and I had recruited 7 patients out of 198 in 33 centers. And we found, in fact, I was at that time, took the trial drug. I got into the trial and took the trial drug Molnupiravir. It's a good drug. It has a very good, if you compare Flavipiravir with Remdesivir, Molnupiravir, I think they are 60, 70, 80% efficacious in terms of efficacy. If you see the net benefit in statistics, there is only 30% benefit. That's a statistics. But if you see, if I have COVID and I'm asked mild COVID, and I know it subsides, and I'm asked to take some medication, and that's where hesitantly we are prescribing Molnupiravir. I won't go more into that. So in this confusion, by what happened is, when Molnupiravir is introduced, suddenly it is on the public domain, so I can take the name. Professor Bhargav, who is a very, very learned man, suddenly made a statement that it causes a lot of side effects and all. I know every drug has a side effect, but looking at the risk benefit, I am of the opinion that yes, there will be few people who might be benefited with Molnupiravir, and I leave it to the clinician who decides it. So when I thought I can skip injections, I thought here is a tablet which is similar that could help me. Genetics and mutations of the virus and drugs have actually added fear. Paxlovid is the drug which has caused revolution in US. It is going to come to India, very expensive drug. And it has got 2 antibody-based drugs. And there are 4 such drugs already available in United States. But I'm of the opinion, the way we look at Omicron and the way it is subsiding reasonably well, we may not have this drug or requirement of this drug. I think this is the sometimes, these things become popular. I can tell you, homeopaths, Unani medicines, they all be sold in crores and crores and crores because everybody said, yes, I can treat. So we were hearing some YouTube discussions by a controversial man. He's there in public domain. So Elementally was talking, there are vaccine opponents which are there in US as well. And they all say there is no need for vaccine, there's nothing. So we are not very sure. We have equal opposition for that. And he's another big man. He came with a very quick drug, even without DCGI approval. And when a complaint, public interest litigation was made, he was asked to withdraw the drug, and then he has to take a special license and convert into an immunity drug rather than an antiviral drug. I don't talk much about it, but I think his model, he first says, do yoga, you don't need medicine, but he has got a 2,000 crore industry. So boosters, precautionary shots, vaccine for teenagers is actually, we have got new semantics with vaccines and jobs. I'll answer if there is a question. But one thing that came out very clearly from this experience is unvaccinated have been hit hard. So you look at the hospital admissions, 86% of hospital admissions, this is a published data, they were not even received single vaccine. And only 36% or 40% received the first dose, and only 56% to 70% in different places have received the second dose. Those people who received second dose are reasonably saved with the infection. So there is something called vaccine hesitancy, which actually is an urgency. We use certain terms called vaccine nationalism. There is an export of vaccine. There was a big issue when Bharat Biotech, or even for that matter, Serum Institute exported a lot of vaccine. The country suddenly realized that we need vaccine, and they put an export block and randomized the vaccine allocation. What happened is only certain government institutions there was a lot of confusion about the vaccine distribution, and there were no stocks of vaccine against the ramp up production. Nobody was very sure, and even a company in Hyderabad, they were not sure whether the government is going to buy or not, and what is the price of buying. Today we have two vaccines, one costs around 800, another costs 1400, and I still have a sincere doubt why government is not able to regulate and make it available for common man. You people who are on high business administration would know the interior facts in all these areas. And case clustering adds to the process of vaccination in the community. This is something which is happening. So we still have a confusion. When do we do the lockups, lockdowns, and lock open? I don't know. These are some of the things which are happening. So the basic for precaution dose, that was the biggest confusion. And a few scientists, in fact, argue that the T-cell immune response is so important and 2 doses are sufficient. I did believe that 2 doses are sufficient. If the third would be infection rather than vaccine, because there are a set of people who after the third vaccine also developed the infection. So vaccine does not protect, but does blunt the infection to a great extent. So if you ask me, do you take a third dose? Yes, they said they will give me on Monday, so I'm taking it. The association between 3 doses, this was a publication which has happened yesterday, and they were very clear that this was a paper from UK, and they clearly said we do take third dose. So I think today we are in a state that we'll accept the third dose as a standard of care, and we do not argue on that. Covaxin has been recognized also as a booster because this went into a confusion, and there was an issue whether we can take 2 first vaccines as Covishield, third as Covaxin. This is a mixed match. In fact, AstraZeneca and Moderna did these mixed match experiments. To our surprise, those people who take 2 vaccines first, took the other one as a third, had a higher antibody response. This happened with many mixed matches. So today, if you are given chance, if you are asked to take, and if you have taken 2 Covishield, you might prefer a Covaxin. Or if you have taken 2 Covaxins, you might ask for a Covishield. Is not a surprise. But I said a poor man will say, whatever is available, please give me, which is much better. So the booster vaccination will prevent, and COVID, there is Omicron vaccine is. Of course, this is a pharma driven. Let me answer to the first one, that all vaccines does prevent Omicron. Take it as a statement today till it is verified with a larger trials. But as of today, all the vaccines are effective. But then again, pharma industry is super fast. They looked at the amino acid change of the Omicron virus and trying to produce specific gene mutated vaccine for Omicron, and that would be a huge market in future. So the new vaccines are Corbevax and Covovax. Serum Institute is starting another vaccine, Covovaccine, which is again a small change. And Biological Events in Hyderabad producing. And Sputnik is a Russian vaccine, which is straight away imported by Dr. Reddy Labs. There was some problem on the second dose import. So there was a delay and somehow they could not make it very successful. Now I think we have right now 3 vaccines on shelf, and 3 will come very soon, and we'll have more vaccines available for our district. I think this is the most exciting that happened, nasal vaccine. Bharat Biotech is taking a clinical trial now. Bharat Biotech
Continue,
is...
doctor. Continue, doctor. Continue. I have a lot of questions for you, but I will ask them. I think at the end of it, I can
no problem.
Continue, sir.
I'm sure I will pass under your examinership. Sure.
Thank you. A lot of questions coming in, but I'll take it at the end of the conversation.
There is no problem. There's no problem. The nasal vaccine, I think this is tomorrow. It's going to happen in about the month of March. The DCGI is hesitant, but I'm sure it will be released. And what you need to do is take first shot. There is a very good trial done by Bharat Biotech, and that is take 1 injection and 1 nasal dose. Take 2 nasal doses. Take nasal dose first and injection. And the data shows if you take first injection, second nasal, maybe you can take like Nasovion drops whenever you want, whenever you feel like. I think it's becoming so exciting that nasal vaccine is going to work wonders in future, and you don't need shots, injections, pains, hospitalization and all. Very easy to. It's going to be great. We talk about herd immunity, and I think what is happening, there was some controversy. Herd immunity talks are irresponsible, but I think there is a very nice herd immunity happening in India. And the best example is the disease is getting blunted. I'm sure in another couple of months, we may not see this virus to be more active, and we will probably even try to forget. And it will be, human race will be winning against the virus is my hypothesis. And a national strategy for the new normal life. Just now, Kavita madam was mentioning this particular topic, the new normal life. I think what we need to new normal life is changing the pattern of it. And probably earlier we used to invite 1,000 people for the marriage. I think taking COVID as a reason, we will invite less. Functions would be less. Hotel going will be less, probably. So I think the market whole scenario will change in particular. And then there is a safety warning for every time. What you do is be careful, you may get COVID. Seems to be a very interesting warning for all the households as well. I think the laughter is the best medicine. I think we have to, at the end of life, we need to smile and say, oh, after all, it's a small game that happened. So I wish there could be one medicine like this, the best medicine, where you can take 1 tablet and smile every day. I remember the great man, I met him twice. I had an argument with him. He said, speak 5 lines yourself. I'm the best. I can do it. God is always with me. I'm a winner. And today is my day. And tomorrow is also my day. Let me add the other one. Tomorrow is also my day. So in life, you would realize that there is a purpose for every person you meet. Some are there to test you, like Professor Suresh is trying to test me. Some will use you. And that's what Krishna Prasad did. And some will, yeah, all your questions will actually teach me. And some will bring out the best in you. And that is where we want the challenge. And I must sincerely thank for the wonderful opportunity given by the Hyderabad Management Association. I could see some of you and meet particularly Suresh. Suddenly he jumped and said, you know, I'm from Thrissur. Then I said, suddenly I realized I should be on his side rather than. And this Malayalis are genetically, they have a clumpers actually. Trying to the past. Thank you very much. So can I remove my slides? I think.
Yes, doctor. Thank you very much. And I will start with the questions. There are a lot of them actually that came in. Doctor, some of them were dealt with during the presentation. Very informative, and I'm sure you'll share those slides with us in HMA, and we can pass them on to a larger audience. In fact, the program is being recorded, so automatically it will go on YouTube. And
No, these slides are educative slides, so anybody can share it. But whenever somebody uses, they can say this is all created by. Because I don't do copy slides.
No, we will give you the credit. We will give you
no,
the
no,
credit.
no problem. Bank credits
Doctor,
are very.
the first question, obviously, since you are giving us a lot of time now to ask questions, that question that came from Ramchandraji was regarding the cocktail injection, and you did mention that in bit during the presentation, because there are these cocktails being now presented. I recently had one of my family friends, father-in-law, who was a retired railway engineer, going in for a cocktail shot for a Omicron that he got. But then we reached there, he was told it is not for Omicron, it is available only for Delta. So I just want you to just let us know, when is it to be used and whom is it to be used, this kind of cocktail injections that are there.
Sir, you are taking away my profession, sir. Tomorrow you might start prescribing. Anyway, let me tell you, I think the truth is like this. Most of the cases, whether it is Delta or Omicron, in majority it is self-limiting, acute illness, acute viral illness, majority self-limiting. We are unable to identify which are these self-limiting. We used a lot of tests. We used what is called interferon loop, that is IL-6. Second thing is we used CRP, C-reactive protein. We also used D-dimer, and we made a panel and started testing everybody. We thought somebody who has got a very high inflammatory marker like IL-6, interleukin-6, they are going to become sick, but that did not happen. There were people who have got a very low CRP and became very sick. I think this ultimately boils down to the host immunity, which is very important. That is why when you look at the Delta, I just quickly finish. I know you have some questions. Delta infection predominantly affected the elderly. Omicron has showed a slight shift towards younger patients because of immunity changes. And majority of those people were either smokers or some other thing. In West, actually, they're all drug abusers who became very sick, actually. So coming to the cocktail injection. So dividing this into mild, moderate, and severe, our threshold became so changed that the patient is admitted in the hospital. I said, take Regeneron and be happy. 65,000 rupees, the injection sold by the hospital. It went as 85,000 and different rates. Let's not go into those murky area. So the injection, if you once give, it produces high levels of neutralizing antibodies and the patient recover. The side effects are minimal. So we want to identify a small cohort of patients who can be given Regeneron, who are sick and came to us on day 5 or day 6. So somebody who comes to me on day 1 of fever, I won't do anything for him for 3 days. Probably I would wait. After 2-3 days, if I find him slightly sick, I might as well start him on Molnupiravir, which is, I call it as a middle class effective antiviral. But if he is found a little bit more sick on day 4 or so, before day 7 is a cutoff point for me. So we would give him the Regeneron injection. For me, the cost also is very important to mention the patient, but majority of the patient, for example, I've seen, if I put a graph where Regeneron used everywhere across the country, most of the people received Regeneron. For that matter, all VIPs in some of the leading hospital in Jubilee Hills, they gave only Regeneron. We were at least calculating. So I won't criticize. Regeneron seems to be a wonderful drug. It will be given between day 5 and day 7 to those sick patients. Otherwise, majority of them do very well with Molnupiravir. The only dangerous drug which I want to do is the steroid culprit. So one must be very careful when they're using steroid. We would like to use an antiviral plus steroid or Regeneron followed by steroid. But today, the steroid usage has come down to less than 10%, which was 80% during the peak.
Thank you, Doctor. In fact, the next question is from Dr. Renuka Sagar, and she has a question where she asks, what is the CT value of 20 to 30? What does it mean? And the second question is regarding the COVID self-test kit. Do we trust it or we don't trust it? So 2 questions for you.
So actually, there was a very nice film which I saw. Maybe I could send it. There was a fellow in this happens in Europe. He was keeping this, and somebody asking, "Do you have the drug? Do you have the?" So he took and then gave them the COVID test kit actually. So the drugs have suddenly changed to COVID test, self-COVID test. They're very sensitive. They're easily done. Should we do a testing? I feel probably we are all confused and we are all worried, and then start the home kit made available. I think if you feel like, okay, do it. And if you come positive, we will advise you. If you are not done it, just don't bother. If your first 3 days were an up and down, don't bother. If there is an up and trying to become more up, please come and consult the doctor. Consult the doctor and discuss with him, do I really need a drug? We don't have a biomarker to tell that you need drug. Coming to the CT value, which is the cycle threshold value, actually what happens is the virus is counted by 2 methods called the ELISA method or CLIA method, chemiluminescence method. Now it needs the amplification. That means if somebody gives me a sample, if I can, within small number, if I can amplify like 10 times or 20 times, that means there's a huge viral load. But if I need 30, 40 times to amplify, it is a very low undetectable. So we made a cutoff below 20. If the cycle threshold or CT value is there around 20, 22, 23 and all, that means he has a significant viral load infection. Somewhere between 25 and 35, we call it moderate. Above 35, we say it is not significant. It may not be even COVID. That's how we use the cycle threshold as one of the marker for the severity of infection or even positivity of the infection. Somebody use it for positive, above 35. They say it could be negative as well. So this is a viral amplification count. The lower the value, the higher the significance. I think I answered.
Yes, doctor. Those of you who have done the COVID test and got the report, you can see those values indicated there, 20 to 25, 25 to 28. And, and then that is where the result is declared as positive or negative. I think in a very good way, very simple way, doctor explained to us as to what it's all about. Doctor, the next question is from Kavita Rajesh, and this question is regarding the mutation of COVID. Usually, the viruses mutate after a long time, 4 years, 5 years. But we are seeing with COVID a rapid mutation that is happening. We saw the earlier version, then we had Delta, then we had now. Actually, for many people, they're not even aware that it all started with SARS, and you rightly described the case in Kerala in point. That is where it started. But how does this mutation, why is it that the mutations are happening so fast, doctor?
Can I tell you something very funny? Mutations are known to virus like anything. It is already known. But it is the first everybody become COVIDology experts. I have worked with hepatitis B throughout my life. I know so much about it. I'm actually proud that we could get some very, very good data, mass vaccination data and everything. We know about this virus. Even virus mutate. All RNA virus mutate. In abroad, you take influenza for that matter, which is the elder brother of COVID. And, it mutates. Some of the mutations are not significant at all. But in a pandemic, anything that happens becomes important. Now, the $1 million question is, will there be new mutants and will our life be COVID? My answer is big no, it will not happen. The virus can mutate only once or twice. See, you know that you can have theft once or twice. After that, you will keep everything in the bank. So you won't keep anything at home. So you know how to prevent yourself. You are vaccinated, you are very careful, you don't do big programs and everything. Now everything is Zoom because we are the biggest losers, that many people are losing drinks and dinners. Poor fellows, otherwise we had a pharma supported meeting activities. And I was the biggest faculty in most of the pharma. So all those things we missed for the last 2 years.
So we shall meet soon, sir. We'll end the break and we'll meet soon.
Doctor, I think, Kavita ji, your question about your son's viral load at 17 has been answered by doctor. It is pretty
Yes.
high as per his.
Yes,
But that doesn't mean anything. We actually don't give any value to the CT value because that doesn't mean anything. It's like having a big viral load doesn't mean anything. It disappears super fast. The virus shreds very fast.
Doctor, my question to you, sorry to interrupt here, Mr.
No,
Suresh.
please.
Doctor, we are talking about the booster dose and all. So most of us are having the third, we had the third vaccine as a booster dose. In spite of the booster dose, you see many are being infected with this Omricon. Why is it so? Because that really shakens your confidence of going ahead with the booster or not.
I'll tell you what we have not done is we have not looked at antibody titers. There are few types of responses. One, when we did a small analysis in a small group of 50 patients, when we looked at their antibody, 2 out of these 50 odd patients did not convert at all. They did not raise antibodies at all. So in a community, when you are giving thousands of population, there is a set of population which do not get seroconverted. And second thing is, all people do not raise the protective value. So we expect a minimum of 2, 3, 400 as units. It's called MI units, and those units are not there. That's why they're not put. So no conversion, poor conversion to antibody is the main reason that you don't get it. However, a mutation can still infect, but you should thank maybe the God Almighty or thank the virus. It becomes, as the virus mutates, it becomes weak. And that is where you get even a second infection. Tomorrow, somebody said you will get Demicron or Fluocron, or some names are given. They might come and it becomes a scientific feat. And the publications, to the extent of about 10,000 publications, which never happened in any time in any science, like every journal has published articles. And initially I started with interest, suddenly became mad, and then I said, let me stop it. So I think this post-booster infection is not something which is unknown, and we don't fear so much about it.
Doctor, thank you. I think Kavitaji, that answers your question.
Yes.
Another question came in, is RAT the right test or RT-PCR the right test? Because sometimes what comes out as negative in one is positive in the other one. Of course, I think doctor will definitely have an answer because he knows from his experience as to which is better than both these things.
So we look at what is called sensitivity and specificity of any test. Now, if you look at the RAT, it is a sensitive test and not specific test. That is, the detectability is very poor. So RAT negative, RAT positive means probably positive. RAT negative may not mean positive. So we resort to RAT because it report comes fast. So today for all our procedures, we are doing RAT. But if you come as an independent and say, I want to know about my COVID, we always depend on PCR, which is very sensitive. So you must depend only on PCR and not RAT. RAT is a screening procedure. If RAT is positive, we'll again go for a PCR.
Somebody had a question. The next question, doctors, regarding the oral pills. I think they are on the way. And as you said, there have been rapid developments in the pharma space. We've never seen vaccines being produced at such a fast pace, because even I was involved with Shanvac at an early stage of my career. And definitely, I just want to know from you as to what are we looking at in terms of understanding the oral pills? Where are they going to come from and how fast are they going to come from?
The first drug that was research was done was on Flavipiravir, and we have used Flavipiravir in the beginning. We don't know whether it responded or not. Studies showed that it is better than placebo, but that's not a good study. We don't have, but we thought, okay, at that time we prescribed for first of a few patients. Subsequently, injection Remdesivir came. Remdesivir is more potent than Flavipiravir, so we started injecting everybody. Remdesivir is available only in injectable form. So we used to give 200 milligrams IV stat injection followed by 100 milligrams for 5 days, keep the patient for 5 days, and had a huge bill. I won't go into that area. So again, it started responding. But we still do not know. When you compare with Remdesivir and placebo, the rate is not very significantly different, but we were all at that time in an agitated mood. Something has to be done. Subsequently, Molnupiravir came, but somehow for some unknown reasons, for I do not know, the confusion between ICMR and DCGI, and Molnupiravir license was terribly delayed, and by the time we lost a good opportunity time to prescribe or have experience. Now 13 companies, out of which 6 or 7 from Hyderabad, have produced Molnupiravir. The cost, which was expected to be around 5,000-6,000, has come down to as low as 1,000 rupees. And now most of the people by hesitantly are using. When I spoke to day before somebody, they said, yes, it is moving reasonably fast and it is reaching the goal which we expected, if not to the full extent. So obviously Molnupiravir is being prescribed by everybody and many people are taking it.
Doctor, as we move towards the ending, I know I'll be getting red flags now saying that we are coming to the end of the session, but there are a couple of more questions. One is regarding how long does the protection from each of the vaccine doses remain? I mean, you answered that in a short way earlier, but if you can just explain to that in terms of dose 1, 2, and booster.
Yeah, actually dose 1 was given day 1 and 28 days is the booster and supposed to last for 6 months. Then there was the government made a delay of 9 months. There are certain reasons for the government because they could not cope up with the vaccine requirement. You know that at one particular time, even the second dose could not be given to everyone who has received the first dose. That was a huge, it was, I won't say unprepared, it's probably unpreparedness of ours to handle such a massive program. But after the third dose, let me give you a small thing. You may not require a dose. This is something which I wanted. The third dose is itself is a precautionary dose. I think the beautiful word was used. The semantics were so good. It's a precautionary dose so that you may prevent. And I guess as we pass the time, we may not require fourth dose, which Israel has done. Or there were some people who have taken 8 vaccines, and because it's given free, somebody took every 15 days, 20 days. He thought it's like some Neurobion or some vitamin injections. There were some in Bihar. Some fellow took some 14 injections, I believe.
Right.
Yes, sir. I can see one hand go up. The name is very, very familiar, Sanjay Kapoor, even though Sanjay is no longer with us, and some using his ID to ask us this question. If there's any question, please ask.
Doctor, needed to actually bring about.
Dr. Sanjay, 1 minute. Let me just correct myself. Dr. Sanjay Kapoor is from the Army, and our ex-General Secretary also, our President was also named as Sanjay Kapoor. That's where the confusion came in. Dr. Sanjay, carry on.
Dr. Babu, I got one particular point which we have been missing out all this while. There is a concept of air changes per hour in all the offices or hospitals or wards or laboratories or technical areas or whatever. You have specifications being laid out. In ICU, it is supposed to be about 15 air changes in an hour. Yani the complete air is evacuated out of an ICU and changed and replaced every 15 hours. Sorry, 15 times in an hour. Now, with COVID, it is supposed to be even more high. Now, unfortunately, if you notice any of our ventilation systems in the ICU, it is based only on a couple of air conditioners. Now, the air conditioners are not effective, right? So all they do is just take out a bit of dust particles, cool the same air and pump it back again. So the bio load within the ICU keeps on building up to such a level. I have lost many of my friends in the army. I lost about nearly 12 to 13 of them in COVID ICU. So I don't know why we are missing out this particular basic factor, doctor. Why are we not looking at just ventilation? Can you just come on it, please?
I see some 2 types of statements in you. We call what are called HEPA filters. These are called HEPA filters. They are actually most of the hospitals, as per the ICMR guidelines, they have got these filters, but what you said is these filters are not very effective in filtering and recycling. I don't have much knowledge, you seem to have more. I won't say that because of the filters, from the large experience which I saw, it's probably not the infection that got acquired in ICU because of these filters. it's already there in the air. I'm not really very competent to, maybe I should verify, but I guess it is not the air pollution that has caused all these things. Everyone, you trace a contact, everyone who has an infection has somebody who has given them the source. If you can do the source, that is why it happens in families. I'll tell you something very interesting, which I have also missed, which thanks to Ms. Kapoor, which is bringing such a very important point, is during the peak COVID, all the adults in the family came to the hospitals. Children did not come to the hospital. That means they have a higher, this is because what is called interferon response in them. I explained this very clearly. Today, what happened is because the virus has changed its, not this one, and the general immunity is a little low in children, we are now getting adolescents getting the infection. I think it's immunity which is much more important than the virus, which is actually not a dominant. And the mortality in ICU, if I confess, is actually not due to the virus. It is because of the multiple complications. We were unable to actually take care. Can you believe that oxygen wasn't available in few hospitals, and then people died because of the lack of oxygen? I shouldn't mention in a public domain, but this was there in the publications. So I think there are multiple causes. Let's pray God to all these people. In fact, we put a, this one in our hospital saying that let's pray. We had a national COVID Memorial Day, and we just kept a, an icon to say that, okay, let's pray all those people who died unexpectedly, as you said rightly.
Dr. Babu, actually, my observation is slightly varied because COVID ICU had only the patients with no other illnesses. They just had actually COVID. My experience.
Yeah. I agree with you.
It turned out to be a very congested space wherein there was hardly any ventilation. When you talk about the HEPA filters are in all the aircrafts. What you're saying is right. They are the best actually source of filtering the air, and they can actually filter out the Omicron also. So actually, in true essence, the aircraft is the best actually means of travel as on today. However, I didn't know that ICMR has laid out these particular guidelines that all the air conditioners of the hospitals and especially ICUs have to have HEPA filters. If that were if that were the case, lot of heads should roll, sir. Sorry, I don't agree that all the ICUs have HEPA filters.
No. Those who don't have, but we have guidelines. Like in our hospital, we have 3 ICUs. We fixed it with the HEPA filters. We purchased and fitted them. I think what you said is agree. There are some, that's again a logistic issues where somebody don't have, somebody have. I agree with you that there was a huge mortality during one particular period because of one of the points which you said, infection getting spread within a room. What you said is right. I agree with you.
Colonel Kapoor, thank you. Colonel Kapoor, thank you very much. And let me now get on to the next question. Dr. Rajendra, you need to flag me if we are exceeding the time. Please kind of let me know if that is the case. Then I can shorten the question. But there are 2 more questions, Doctor, for you.
Yes.
And after that, I will simply close. One was regarding if somebody has 2 doses and gets an Omicron, when do they take the booster dose? Then that's a question for you, Doctor.
I don't think they need a booster actually. We tell them check the antibody. Like
antibodies.
Yeah, you check your antibodies if it's more 300, 400 and all. Don't go on having injection because this doubt will come every time because antibody has got a half-life of 3 months. So at the end of 3 months, suppose I have 1500 today, let me check after 3 months, it will suddenly fall to 600. Or let me check after 6 months, it will suddenly fall to 200-300. But if I have an infection, suddenly it raises to 1200 or 1500. So this is like any other viral illness. We don't have to get a 3rd dose, 4th dose like that. So if you have 2 doses and an infection, you do not require vaccine is my recommendation. But if you are afraid, just take the 3rd dose. Don't even argue on that.
I think that question came from Dr. Nayana Joshi. I think she is a medical doctor, if I'm not mistaken, or a PhD. I'm not really sure. Yeah. Mr. Ramchandra, I think your question also got answered with that, sir, that can a person affected by COVID with 2 doses be thought to be equivalent to have a 3rd dose? I think doctor answered that in terms of the antibodies. We need to check our antibodies.
Yes, thank you, sir. Yes.
Wonderful session, doctor. And I think as a closing comment before I get in Mr. Ravi Kumar Jain, our secretary, to do the vote of thanks, I should mention that we have a monument in Hyderabad called the Charminar. All of us have seen it. Many of us are not really aware that that monument was built for a purpose. It was built to signify the eradication of plague.
Yes,
and one day when we kind of consigned to the dustbin this COVID vax kind of virus that we see, I think sooner or later we will have to build another monument for that. Thank you very much, Doctor, for a wonderful session. A lot of interaction. I think we could have gone on and on, but I think there is a limit to it. I'm sure people like Colonel Kapoor, who asked that question on the specifics of the air conditioning system, we will need to have more of a technical session there to discuss that. And Mr. Ravi Kumar Jain, sir, the field is yours now, so take over from here. And I should thank all the participants who were there today.
I think before, I'm just one small, sorry for this. I should thank Venkata Krishna Prasad, who actually introduced all of you, and I feel privileged to know some wonderful people like you all.
So thank you, sir. We want your active participation. NPOS will be bothering you now and then. Thank you so much for accepting, sir.
Thank you, ma'am. Thanks a lot, ma'am.
Thank you so much.
Namaste, ma'am.
Namaste, Mr. Ravi, sir. Now we can take over.
Dr. Ravi Kumar Jain, you have to unmute yourself. Maybe he's on another session.
Okay. Should Kavita ji, you take over then and propose a word of thanks? Mr.
I think if Mr. Ravi is busy, I think we can give this opportunity to Venkata Shankara Krishna Prasad Garu.
Okay. Can you take over, sir?
Yes, sir. Yeah. Thank you very much, Madam President and the rest of the members. Thanks everybody who has attended this. I thank the convener Rajendra Krishna Prasad Garu for very quickly connecting with Dr. Sethu Babu Garu. Dr. Garu, you have actually given us a lot of practical views about it, and you have that natural wit with which you deliver, and then it sinks in. Obviously, it's not just a KIMS patient, but everybody on the call here. And I would thank Suresh Kuchatilji, who has been a very excellent interviewer. And he's a journo, and he's wrapped into multiple things. So I'm really glad that you have come to HMA as a life member. Welcome, sir. And in these times of, to do or not, what to do or what not to do, the Shakespearean dilemmas, you have given us a real practical, exposure to how to look at the things and then do it. But at the end of the day, you all have very strongly driven a message that we have to be careful, irrespective of whether it is COVID or Omicron or any of its variant. Okay, at this point of time, we would request everyone to take care. That is one. And on behalf of Hyderabad Management Association and on my personal behalf, I thank both of you, the presenter, Dr. Sethu Babu Garu, as well as Suresh Kuchatil Garu, who has interviewed him, and also rest of the members who are here. Ramchandar Vyaspatkar, who is the Vice President of HMA, Ravi Kumar Jain Garu, who is the Secretary, and of course, Geeta ji, who has been following it up, and Jayavant Naidu Garu, our Treasurer here. Thank you very much, everyone. I hope you have got a lot of takeaways from here. Your presentation, Doctor, if you could share with the organization, we could try and share in turn with some of the people who required it. Thank you very much.
Yeah.
Thank you, sir.
One more small thing, sir. I think I would like to announce that Venkata Krishna Prasad Garu in advance birthday greetings. Tomorrow is his birthday. We wish him very
advance wishes to you, sir. Wishing you a very good health.
Thank you very much.
Thanks
for your blessings.
Of the day, SVKP Garu.
Thank you, sir. Thank you, sir. I did your job today just now.
Many happy returns of the day, sir. Krishna Chaitanya.
Thank you, Krishna. Yeah, thank you so much.
Thank you, Mr. Sureshil. You made it, Suresh Kochital, you made it very vibrant, and Dr. Sethu Garu, it was very interactive and informative. Thank you so much, and wish everybody happy stay. Take care.
Thank you, sir.
A very good night, sir.
Thank you. Thank you so much.
Forward, Sethu Babu Garu's more associations, sir. We know a friend of HMA.
We should look for more.
He got a fantastic sense of humor. Yeah.
No, I think we should have one session on the gastroenterology, of which he is the specialist.
Yes, sir. Even that is needed. It is a good subject.
I think what you people need is how to handle burning in the stomach.
And let me tell you, he has promised a regular column on the management review on the business of gut or something like that, right? You're going to start with that.
As somebody was saying, why we have immunity. We are people who eat pani puri by the roadside. So forget Omicron, forget Delta, anything. We have the high levels of immunity.
Suresh, I'm one among them. Thank you. I think Karthik, you can call off the meeting.
Sethu Babu Garu, excellent, sir. Your sense of humor is fantastic, sir. Sethu Babu Garu.
Sir, good day, everybody. I'm ending the meeting.
Good day. Good day.
Thank
Have a
you.
good day.
Thank you very much.
Thank you, Raj.